Hey Jeff, I've got a table in the corner and the internet connection is fantastic. Bring over the beers.
Oh, that's great. That's great, man. Here, got you a beer.
Oh, fantastic.
All right. Good work. All right. Oh, hey. Welcome.
Afternoon.
Yeah, welcome to Blocktober Pub Trivia. A first, but maybe not the last. We'll see how everyone does. My name's Jeff Gadsden.
I'm Stuart Grant. Pleased to meet you.
And we're your quiz masters for today. We're going to take you through a bunch of regional anesthesia trivia to test your knowledge. Now, you should see a QR code on the screen, and you can use, if you're following along on one device, you can use another device to scan that code, and that takes you to the gameplay interface. So if you're playing by yourself, you're playing in a team, just use that device to answer the questions. It'll be really easy, and you'll see how this all works. I hope everyone's feeling ready. Are you ready?
I haven't had much of a chance to check the questions, so I hope I don't make a fool of myself today. Because I don't.
Would that be different from another day?
Yeah, thinking about that, not too bad. We're here drinking. This is Blocktober IPA, and the IP stands for interpectoral ale. This is a little bit different from traditional IPA. It's a little bit more meaty, a bit less hoppy.
It unzippers nicely in your mouth.
Oh, that's nice. Yeah. I like that.
And this is a competition, and there are prizes. So while you're getting set up, let's go through some of the prizes that our contestants are playing for. Some DukeRAP scrub caps, always handsome.
Can't wear that at UNC.
Well, maybe the one place you can't. We have some DukeRAP merchandise, some Duke merchandise.
Okay.
Represent, okay. And you'll also get a handful of Got Block stickers. For those on your ultrasound machine.
On your ultrasound machine, yes, correct.
For that just-in-time learning experience, and maybe some more stuff coming your way for the victors of this challenge. All right, so
I'm going to flash up that QR code. So hope you can scan the screen. And I'll get rid of us so that people can actually read it and see it.
There we
go. Scan the QR code to join.
All right, I think we've got a bunch of teams and players logged on.
Oh, fantastic.
And while you're following along, feel free to put some comments, some encouragement, maybe some trash talk into the chat bot, to chat on the YouTube channel, and we'll give you a shout out. Tell us where you're from, where you're competing from, who your teammates are, what your team names are. Oh yeah, pick it when you log onto the thing. You've got to pick a little team name. So make it a good one.
So Alan McFarlane is clued on here with his own name, and he's worried about use. So he's going to use a fake one when how many gets correct versus incorrect.
Yeah, that's a bold strategy, Alan. Using your own name.
unless that's somebody else from Glasgow tuning in as Alan McFarlane and choosing to get them all wrong. Well. That'd be a good excuse you could use. Oh, somebody hacked my number. Yeah.
All right, let's get started. I am going to start the... I'm going to give you a few seconds to get your thumbs ready. 7, 6, 5. And our first question, we're starting with the softball. Which U.S. state is DukeRAP located in? Is it New York, North Carolina, California, a state of confusion, or Texas? And you'll see as the 15-second timer goes, the quicker you answer, the more points you get.
Oh, I didn't know that.
Yeah, it's a sophisticated game. Here we go. Oh, we got some 80% answered correctly. North Carolina. We had some. Thankfully, no one said state of confusion.
So where on the map is North Carolina? Well, if you look at the map with questions, we're on the eastern side.
Yeah.
About halfway up and down the eastern seaboard as well.
Yeah, with a little orangey red state between the blue and the yellow one there. Okay. Yep. Nice place to live.
Great place to live.
We got ocean. We got mountains. We got each other.
I got you, babe. Oh, that's a song already.
All right. All right, next question. Here we go. What is the model name of this classic ultrasound machine?
Ooh.
Who's used one of these? I have.
When it was new and modern and shining out of the box.
Yeah. All right, there's some choices on the board, and whoops. I'll go back to this question. Oh.
We're going to have to replay.
Replay. Yeah. I guess you get two chances at this one.
Fat fingered it already.
Yep. It might have been the
I thought we were coming back with some
Blocktober
potato
IPA.
chips or nuts from the bar.
Ah, they were out. Scotch egg?
Oh, okay.
Pickle?
Oh,
all right, let's see who got what. Yes, so, and the correct answer, the Micromax.
Titan was the first one. It was grey, like my temples. This is the next model, the Micromax, which was a snazzy metallic blue.
Yeah, the Fuzzy Max 2000. Okay, so, excellent. All right, let's just take a look at our leaderboard. Oh, what we got here? We got...
Chris, we need you to log on to the YouTube chat and tell us a little bit about yourself. MC Lotmix coming in there second. Alan third. Davey Mac 4. Amit P a distant fifth.
We're not supposed to trash talk the competitor.
Oh, sorry. Quasi K, I recognise name it. Rebel Summit. Yeah, okay. Toro, Zulu, DD. Oh, there's a few. Yeah, okay.
Yeah.
Good.
Great, yeah. Recognize some of those names. Fantastic. All right. Question number 3. Which nerve is a target during the PENG block? And there are your choices. Yeah. Questions are getting harder as we get on.
It's like real regional anesthesia stuff.
Yeah, I know.
Prevent the fluff.
Yeah. All right. And we had most people getting the correct answer.
Fantastic.
The accessory obturator nerve. Fantastic. That's good. Do you do a lot of PENG blocks?
Doing more.
Yeah.
Doing more still. I think I said in the live thing last week, I'm still a big fan of the suprainguinal fascia iliacum.
Classic. Yeah.
But no, we're doing a few. Plenty to show there isn't. Plenty of hip fractures coming through our door, unfortunately. Yeah.
We had a patient this week who had cerebral palsy and contractures and was having a big lower limb thigh procedure, and we were aiming to do a lumbar plexus block, but because we couldn't turn her on her side because of the contractures, we said, all right, well, figure what to do, and Sci-Fi ended up being the winner.
There we go.
Yeah, it was just get enough room to
Just
get the probe in
to
there.
get the probe in,
Yeah. Good. All right, take us back to question number 4. Hope you guys are feeling warmed up now. According to the ASRA Pain Medicine guidelines, which medication should be held for 72 hours? Is it apixaban, clopidogrel, dabigatran, prasugrel, or garlic knots?
You had me at garlic knots.
Oh, can we get some garlic knots over here, please?
We don't have peanuts. There's very little chance we make garlic knots.
I'm getting hungry. Yeah, so there we go. A variety of answers, but the correct answer, apixaban. That's pretty good. People have this information at their fingertips. That's impressive.
I get asked all the time, patients on anticoagulant, what do we do? And I just say, get the ASRA app.
Yeah.
Get the ASRA Pain Medicine app, ASRA Pain Medicine app. And I refuse to answer the question because I'm trying to teach them how to farm and grow the wheat and make the loaf rather than just give them a cheese sandwich.
Yeah, I feel like my brain is full of stuff, and as soon as one thing enters this way, another comes out. So
yeah, my Achilles heel ever since med school has been coagulation. Learn it for the exam, walk out, immediately forget it.
Can you draw the extrinsic pathway, please?
No.
Okay. Yeah, so clopidogrel would be 7 to 10 days. Dabigatran is 5. Prasugrel is again 7 to 10. Garlic is in the guidelines as something to think about, but you can eat as much garlic as you want prior to an epidural. All right, question 5. We know the sciatic nerve is the biggest nerve in the body. Which is the smallest named nerve? Tough one. Tough one.
There's a few contenders there. Yeah.
A few contenders, yeah.
And this is where we really sort the wheat out from the chaff. Who just like thinks they're a pretender regional anesthesiologist, and who really does know what is their big nerves from their small nerves?
All right, let's see. We've got, over half of you got trochlear nerve, which is the correct answer.
Wow.
What does a trochlear nerve do?
It slows the heart rate during eye surgery.
There you go.
Stop tugging on it.
It lets you look down, right?
Yeah.
Superior oblique.
That'll be the one. Down in it.
Gives you that side-eye glance.
Yeah. Dodgy geezer sitting
That's
next
right.
to you. You
That's
use
right.
that one.
Trochlear nerve. All right, let's take a look at our leaderboard. Where are we at? Oh, wow. Chris. That is impressive.
And it's Chris from Vancouver.
Chris Prebicar. Yeah, nice. All right. And Alan clawing his way up the charts.
Left to eat, although he is complaining that he's a break because he's almost finished his beer.
Let us know in the chat if you need a beer break, potty break. Okay. All right. Back to our game. Question number 6. Which of the following was not done to test the spinal that August Bier did on his trainee, August Hildebrandt, way back in the day? Was it brush the skin with a feather? Was it insert a needle into the lower limb? Was it to tug on the testicles, strike the shin bone with a hammer, or place a lit cigar on the skin? Implying that he did 4 of the 5 things. Which one did he not do?
Okay.
I've often wondered if we should repeat that experiment. You and me.
Rock, paper, scissors. We'll leave the tug of the testicles, or as it's translated to Glaswegian, that's the ball bag.
Okay.
Okay.
So interestingly, I'll get a spread of answers here.
Yeah.
So maybe this story is not as well disseminated as it maybe ought to be in terms of what they did to each other. So, great story of the very first spinal anesthetic. August Bier was a pupil of Heinrich Klinke, who famously invented the lumbar tap and pulled CSF out. But then he thought, why don't I put some cocaine in and effect a block of the lower limbs? And so him and his trainee. We can't do this with trainees anymore.
No, but he was even braver. He did it in patients before he did it himself. He wasn't that. Maybe lose a couple of patients.
We need
go wrong.
Yeah. So,
before IRBs.
But one glory-filled evening, Bier and his trainee sat around, did spinals on each other, and then tested the effect.
Both get thumping spinal headaches.
But the thing they didn't do was with the feather. Everything else on that list was fair game, much to their chagrin when the spinal wore off. Okay, question 7. This image shows a non-image guided block being performed. Which is it? Now, I've got the gray hair to prove it, but I did a lot of non-image guided blocks in my day, training, and ultrasound came along just at sort of the end of when I was training, so, but I learned a lot of these. Let's see.
This is one of our cases from way back in the day.
Is this your picture? Oh, fantastic. All right. This is indeed, see a lot of, I wondered if we'd get a bunch of answers on this one, and sure enough we did. So, but the correct answer is the subclavian perivascular block. Now, have you done a lot of these?
Was the go-to for limb surgery. Nobody did a supraclavicular. It was really kind of foolish to aim immediately towards the rib because you'd probably miss it. That was a high incidence of pneumothorax. I never did a supraclavicular, which I do a lot of now with ultrasound. But Alan Winnie's subclavian perivascular description. So what I find interesting, Raptor's on there. People get all upset because the Raptor, you don't see where the needle goes. well, you never saw when the needle went. When you did things with
Subclavian perivascular.
or any block with nerve stimulation. But this one, you stuck the needle down the neck, behind the clavicle, hopefully lateral to the first rib and got the brachial plexus. And great block. Set up really quickly.
Yeah. Good picture. All right, let's take a look at our leaderboard. Wow. Chris, crushing it. Alan and Tato also doing very, very well.
Brilliant.
Yeah. Oh, this girl Blocks coming up.
Yep.
Yep. There's a Jeff on there.
Are you?
Wait, am I playing?
Are you playing?
Separately, I got it.
You can't do two things at once. I know that. Yeah.
Darn it. Okay. Question number 8. Piezo in piezoelectric effect means what? Does it mean vibrate, move, pressure, relax, or is it just a delicious baked good? Piezo. Okay, meat pies.
Meat piezo, yeah.
That would be good.
Curry chicken piezo.
Oh,
Yeah.
pub trivia with a meat pie.
It's,
Magic.
Tune the fat, just the way you make them boby, frozen in the middle and burning hot on the outside. Yes. Yeah. 2 pies, please.
All right. And we got see, I thought we'd fool some people on this one.
This was in here to sort out the wheat from the chaff.
Full disclosure, in all honesty, I would have got this wrong. I would have said A.
And I looked it up. For a tricky question.
But apparently comes from the Greek for pressure. So it means squeeze or pressure. Piezoelectric.
Okay.
There we go. See, this is trivia. You're going to pull this out on Monday with your team and say, by the way, did you know what piezo meant?
Completely pointless. That's all the stuff I remember.
All right. Which song is not on our Regional Anesthesia Spotify playlist?
Pop-tastic tunes here, Jeff. Comfortably Around by Pink Floyd. We Three, My Echo My Shadow Me by the Ink Spots. Cocaine Blues. Nerve Flip by the Red Hot Chili Peppers. And If You Want Blood, You Got It by AC/DC.
Yeah, it's regional anesthesia is easier to do with music in the background.
Much easier.
Yeah, it's a very lyrical type of medical practice. A lot of swaying involved. And we got...
Oh, we managed to catch out 33% of people who went for the fantastic If You Want Blood, You Got It by AC/DC, but that's on our trauma OR playlist, not a regional anesthesia.
different playlists.
Yeah.
Yeah.
We'll get Echoes, we've got Numbing, we've got Cocaine, and we'll get Nerve Flip. This should be the obvious 4 regional anesthesia ones.
There we go. Okay. Question 10. Depositing local anesthetic between psoas major and quadratus lumborum is a description of what? Which one of these blocks? QL1, QL2, QL3, or lateral, posterior, anterior, to use a more contemporary nomenclature. QL18, erector spinae plane block. Let's see. Aha, yeah. 3/4 of you got the correct answer. QL3, or anterior QL as it's called now. And yeah, well done. Did you what QL variety do you favor?
I'm probably the lateral QL for a lot of our,
Uno.
yeah, and then if I can, if they're slim enough, I try the anterior every now and again, but often the body habitus makes it difficult
Precludes it. It's nice not having to turn them. You know, just to like wedge the probe on this side and do a...
I do them sitting up like for a spinal for these anteriors.
Oh, look at you.
Cut them up in a ball.
Look at you. Okay. All right.
Get them put them in beforehand, that is.
Yeah. Well done. All right. Question 11. The tubercle of Chassaignac is an eponym for the horn of the hyoid, anterior portion of the cricoid cartilage, transverse process of the 6th cervical vertebra, tip of the massoid process. I'm pointing to somewhere over here. medial portion of the clavicle.
Yeah.
Chassaignac. I just enjoy saying that.
Yep.
I feel like I need a beret.
It's one of my favourite tubercles. Yeah.
Yeah, yeah.
I have many tubercles I like, but Chassaignac might be my favourite tubercle.
You're not wrong.
Yeah.
All right. And the answer is the TP of the sixth cervical vertebrae. Yeah, the anterior tubercle.
Yep.
It's nice. I've not done a procedure where I've had to palpate that. I mean, that's the whole point of this, right? Is that it's very prominent. You can.
So you go far enough back. Image intensifier was used for stellate ganglion
Time
blocks.
machine? Time machine back?
Yeah, time flip. And, ultrasound has changed the image
Yeah.
that we look for. But feeling 6 and then going just below it to deposit your, it's a good sign to look with an image intensifier when you're placing your stellate ganglion block.
Okay. Wow.
It's tightening up.
Yeah. Oh,
Alan's,
Dr. Aurora's coming up.
Yeah.
There we go.
Ed H, IV, Schlott, Garrett, Nidchat, Shane C. Power, okay.
Okay.
M&M's here, all the way from Detroit as well.
It's early days, guys. We're not even a quarter of the way through here, so we there's time to catch up. Lots of time.
Mm-hmm. Lots of it.
If you think Chris is unbeatable, you might be right, but there's a chance. Question 12. Jimmy Buffett steps on a pop top and cuts his heel. Famously. Which spinal root is fired up as a result of his heel laceration? Is it L3, L4, L5, S1, or S2?
I don't know, I'm just humming the song.
Yeah. Nibbling on sponge cake. Get a sponge cake. Get a sponge cake over here, please.
This bar's rotten. There's nothing in it.
Zero service here. 1 star, I would not recommend. Okay, so the correct answer is S1, and most of you got that right. So
Fantastic.
Heel innervated by S1. All right. Question 13. Which of the following is the best indication for an obturator nerve block? Is it a skin biopsy of the thigh, inguinal hernia repair, knee scope, bladder tumor resection under spinal, or the trainee's never done one before? And you know what? Maximum resident benefit.
MRB.
MRB. Mm-hmm. Which honestly is a good reason. We do a fair amount of that. To be honest.
To show people, or
no, I mean, especially in a training program like this, I feel like it's a good question. Like, what does what does a resident need to graduate with to feel competent doing in practice? Different answer for a fellow.
And the fellows should definitely, I think, leave comfortable and happy doing this.
Yeah.
But it's often put in for amputations, above knee amputations, and that's part of this block is part of the psoas.
I think on this list, I think the one that comes to mind is the bladder tumor resection under spinal. So when we've done this just as recently as last week, and the issue here is if the surgeon starts using electric cautery inside the bladder and gets close to that obturator nerve, which runs along the bladder, all of a sudden you get a adductor contraction and it claps him or her on the head, which is one issue, but also a high rate of the resectoscope then going through the bladder wall and causing a perforation. So this is a good thing to do when you're doing a TURBT under spinal. All right. Next question. Which structure passes under the flexor retinaculum at the wrist? Is it the median nerve, ulnar nerve, anterior interosseous nerve? Is it the extensor digitorum longus tendon, or the radial nerve?
There's no all of the above answer. So.
The answer is the median nerve. Did you ever do wrist blocks blind without ultrasound?
Yes, wrist blocks blind. It's interesting, the hand surgeons, they actually will use ultrasound and put the smallest dose of steroid directly in the median nerve. So say it's a pregnant woman who's got bad symptoms, in the clinic they'll put a microdose of steroid in there to try and relieve the symptoms. When
I was a trainee, we had one surgeon who loved wrist blocks. Everyone else wanted a brachial plexus block. So we got a lot of practice doing these blind wrist blocks, which make me nervous now thinking about what we were going through, because you go down and hit the carpal bones and then come back a bit and
I
inject.
worked in an emergency department job in Glasgow many years ago, and that was, it was digital block. If it was something, then we did a lot of wrist blocks for iron brush and pine sol. When you washed out the cuts and things from the.
Sounds uncomfortable. All right, this is going to test if you've been paying attention to some of our stuff here from DukeRAP. Which member of the DukeRAP team is pictured here? Is it Giselle McQuah, Amanda Kumar, Sophia Dunworth, Aaron Manning, or is it Hector Martinez-Wilson? Please, somebody answer E.
Hector's never looked better.
Correct answer is Amanda Kumar. And let's see how we did. Nobody gets Hector. That's fair.
That's okay.
Fair. Yeah. Giselle got some answers. Sophia, Aaron. Yep, that's Amanda. Take a look at our leaderboard. Oh, there's a new king in town.
Wow.
Alan McFarlane has taken the lead. But it's a narrow margin. Anything can happen. Yeah. There we go. All right. Question 16. Which of the following sites has the fastest absorption of local anesthetics? Is it femoral, popliteal sciatic, infraclavicular, intercostal, or Bryan sites?
Oh, I see what you did there.
Yeah. Okay.
Yeah.
So that's
Bryan sites answer. I love that.
that's great.
Please cut that person off.
Okay. Next question. Okay. What's the pKa of bupivacaine? Straight knowledge question.
Oh.
What's it going to be? What do we think?
A lot of guessing going on here, I reckon.
Yeah. I mean,
and it's kind of evenly split across all.
that's right. The correct answer is 8.1. A third of people got that, actually.
Yeah, okay.
It's pretty impressive. That's pretty impressive, yeah. So, all right. This is a separator question, All right. Which of the following Blockstars has not worked in Scotland?
That's a really, really...
So I'm sorry. Is it Prit Anand, Harry Kalagara? Is it you, Stuart? Alan McFarlane or David MacLeod?
The clan MacLeod.
Of the clan.
Can be only one.
There can be only one. Okay. And the answer... Oh, okay.
Oh, yeah, another... who are these people?
Who are these people?
Nobody knows.
So Prit works in Singapore at the moment, but was in Edinburgh, I believe. Yeah.
Harry worked to Glasgow Royal Infirmary in Glasgow. I worked at the Royal Infirmary in Glasgow. Alan McFarlane.
Well, you've been to Scotland.
Just once or twice.
Okay.
I went to Scotland on vacation.
Nice. And the correct answer, somewhat not intuitively with that name, David MacLeod, one of the DukeRAP block team members from England. That makes a big point of saying he's from England and not from Scotland. All right. All of the following local anesthetics are racemic mixtures, except which? There's your choice. Four choices there.
No racemic.
Which one is a single stereoisomer? And we have prilocaine as the answer. The correct answer is ropivacaine. So is a stereoisomer very, very similar to bupivacaine, but the rest are racemic. All right, let's take a look at our leaderboard. Let's see who's... Oh, Alan pulling a little bit ahead there.
I think he may have got the score.
He might have got the... I reckon you're right. All right. Which of the following blocks is indicated for treatment of post-dural puncture headache? hopefully you're not getting these. Hopefully you're just preventing them in the first place. But should you get one, which of these blocks is helpful? Now, total spinal will treat a headache.
Yeah, you
Technically correct. Probably not the answer we were looking for, though.
Bit extreme.
A bit extreme. So we had 90% with the sphenopalatine ganglion block, and there's different ways to do this, right? There's the very common ways to soak a long Q-tip in local anesthetic and do a COVID test, put it way back, and do a sort of transmucosal approach to that sphenopalatine ganglion through the foramen.
Well, you got a lot of chat with that during the month about, is it really a sphenopalatine?
Oh yeah.
Yeah,
we do
it.
Yeah,
chronic pain fellows.
That's right. Yeah, so there's obviously a percutaneous approach as well that goes through the side of the face. But a great block. I am impressed that someone chose total spinal. Thank you for that.
Time is point, says Samtani. You are right, Samtani.
Yeah.
Got to be quick with the fingers on that button.
Radial nerve is to posterior cord, as suprascapular nerve is to fill in the blank. Is it superior trunk, lateral, medial cord, inferior trunk, or middle trunk? All right, and survey says superior trunk wins, and that is the correct answer. Very good. So, which is why interscalene block is so great for shoulder surgery, right? So if we talk about alternatives to interscaling, if we can't do interscaling for worry of phrenic nerve blockade, and this is a nerve block that comes up frequently as an alternative. Okay, which of the following is a genicular nerve? So most of these are not, and one of them is. Which one is it? All right.
You don't have the ansa genicularis up there.
Ansa genicularis, right. And the correct answer is D, inframedial.
Yep.
Yeah. The rest of them are all made up, but yeah, good one. All right. Yeah, full disclosure, I didn't think about genicular nerves before a couple of years ago.
Nope.
I mean, it just was something that I had kind of heard of in the chronic pain world, but it's only recently become an acute pain technique to try to get people through their total knees, especially with good experience. All right, history question. The first peripheral nerve block was performed in New York City by which one of these esteemed, distinguished gentlemen? And they're all gentlemen, I think, in this case, yeah. And the answer is William Halstead.
William Halstead.
Yeah.
Yep.
Yeah, August Bier.
He left some of the cocaine for his patients. Famously, he dabbled and used quite a bit himself. But one day when there was some left over, and he put some in. And there was a direct cut down onto the brachial plexus.
Yeah, he cut down and just dropped some on his ulnar nerve. But he became addicted to cocaine, and the rest
joined the Rolling Stones after that.
That's right. He's about as old as Mick Jagger would be. All right, the interthecal sac typically ends at which level in newborns? Is it L1, L3, L5, S1, or S3? Variety of answers. And the correct answer is S3. S3, S2 or S3 is about where it ends, the thecal sac, which gives you a little bit of wiggle room during the caudal blocks to get the cannula or the needle or the local anesthetic in there without getting it intrathecal.
So I remember being taught to do spinals in newborns.
I'm just going to hit the restroom, okay?
You're going to the restroom. Yeah. And 1 millimetre per kilogram, that was the guidance you were given. 1 millimetre per kilogram. So it's... we're going to have a little bio break, Alan. I understand you're desperate. The beer is going through you. I think I bought Jeff a special beer here. This is our failed block sour. Is actually this one we're using here. I don't know if you focus on that. Yeah, failed block, and of course it is a sour ale. If you're going to have a failed block, that's the type of beer we're going to have. And we've got a few people changing the leaderboard. Devesh, he's moving up. His answers are going well. And it looks at some people in India are even staying up in the middle of the night to answer these questions. So I applaud the effort for people staying up in the middle of the night. For those of you tuned in a little bit earlier on, we have got a corner in our local pub. Quite a nice little spot here. Jeff and I having a beer, and we've got about halfway through our questions. There's going to be 40. There's just over 24 gone now. So hopefully you can see how to scan to join. If I go back to our page, if you're joining late, please feel free to join us. Please join and look at the QR code. I'm going to take off the keyer here just so we can see this. The QR code in the corner of the screen. Scan that, take a photo, go to crowd.live /DukeRAP, another way to join. Great when you're taking part, great when you're joining in.
Yeah, fantastic.
So I'm just going to say thank you from everyone here, Jeff, that you did take the microphone off before you went to the restroom.
I remember that step. This is not my first.
Not your first interpectoral ale. Okay, good. So let me find the screen and tuck us up in the corner, and then let's get on with the questions.
Yeah, here we go. 25. Which of the following factors most influences the cephalad or cephalad spread of local anesthetic during spinal anesthesia? Baricity, patient height, age, sex, or obesity? Let's see what we got. Baricity. Boom, boom, boom. Baricity. Correct answer. Very good.
Yeah, most people got that one correct. Great.
Yeah. It's reassuring. Mm-hmm. It's good. I mean, I think that there are some that I would have gotten wrong on this, but the ones that I may have gotten right are the same ones that other people are getting right. So.
With somebody thinking it's fake news with you moving the questions back and forward. Fake news. So
what?
Think you're stuffing the ballots.
Really?
The election is fixed. Some people sound bitter. They're down the leaderboard already.
Your colleague breaks her fourth finger, ring finger, lifting a patient. Which nerves must you block to facilitate awake fracture repair?
I was distracted there.
Fourth finger, you're going to do some forearm blocks. What do you need to get that job done?
There's a pig in the market. Low slow pig, you stay at home. Roast beef. None.
None is not an answer.
None's not an answer here, though. No, okay.
And we have... a spread. Okay. Correct answer is E, median, radial, and ulnar. Fourth finger is a bit special, right? Because we got ulnar nerve coming down the middle. You ever blocked your ulnar nerve? For fun?
Yeah, we used to...
Safe space.
Safe space. So nobody's watching, so I can tell you that when we used to do workshops for ultrasound, rock, paper, scissors, who lost, you demonstrated with a nerve stimulator and a needle, maybe a little bit of local anaesthetic for the people who attended the workshop.
There we go.
Use some chloroprocaine or bupivacaine, really small volumes.
Wears off after a while.
Yeah. Mm-hmm.
But what's interesting about it is it truly is, I mean, in most people, there's a bit of variation, obviously, but truly is right down to the center of that fourth finger. So if you're going to get that, you need ulnar, median, and then in the back, you need the radial. Yeah. Mm. All right.
I thought you were going to say special because that's where you were wedding ring. But
that's true. Which of the following most influences speed of onset? of peripheral nerve block? Which one of these factors? Peripheral nerve block. Can you draw the ester linkage?
Can I draw the ester linkage? I'll draw it here.
I cannot.
No.
I'm not gonna. I'm not saying I can.
Chemistry was never my strength.
And yet, 70% got the correct answer. pKa.
Wow.
Yep. So the greater the proportion of unionized local anesthetic, the faster that will cross over into the inside of the neuron. All right. Question 28. The institution where you can find M. Kwesi-Kofi, ropivacaine, John Bailey, X1314, and Zerb-J.
Those are some mean Twitter hashtags. I wonder if we'll still be in Twitter in a few weeks.
Oh yeah, a lot of things happening with Twitter. But I mean, all these people on this list are fantastic physicians and
researchers, good eggs.
Powerhouse.
Yep.
Powerhouse department there. So,
where are they from?
Where are they from? Sadly, not University of North Carolina or Duke, but they are from Dalhousie University in Halifax, Canada. So shout out to those Nova Scotians. Yeah. All right. Which of the following is the principal blood protein that binds local anesthetic?
I think this question could be controversy.
Ooh. Okay.
Okay.
Another fake news question?
Well.
Let's see. Well, I think we got almost 2/3 with the correct answer. So that's something. You've got a different answer, you're out of luck. No, I mean, put it in the chat and we can have a discussion about it.
Yeah.
But
is it albumin? Is it
one
glycoprotein?
All right. Getting around to PEX blocks. Which of the following would a PEX 1 or interpectoral, shout out to our newly released Blocktober IPA, interpectoral ale, be best for? Is it minimal invasive mitral valve surgery? So a couple of incisions here in the chest. Is it simple mastectomy, cabbage with a midline sternotomy, open thoracotomy, or as a rescue after a failed ESP? Got simple mastectomy. Okay. All right. Interesting answers to this. Okay. So the correct answer was A. Minimally invasive mitral valve surgery. And maybe this reflects what people are using the PEX blocks for mostly. Because I don't know about you, but I hear PEX and I think breast surgery mostly. Right? But we do use it for other things. And so remember, the PEX block is, the PEX 1, the interpectoral plane block, is a blockade of the lateral and medial pectoral nerves, which get the pectoral muscles. So very little in the way of skin, breast, subcutaneous tissue. And so so if you just did PEX 1, you'd just be getting those muscles. And when the cardiothoracic surgeons cut through the PEC muscle, that's a good indication.
Okay, so we've already got a question from Alan McFarland that says, is there a comparative RCT for that? Well, Alan, actually, the Institute of Studies came out with a concise PDF that's very glossy that told us that is the correct answer. Check out the Institute of Studies. Great place.
Yeah.
Any complaints, go to www.blocktobercomplaints.com and I'll wait a reply.
Just wait for it.
Yeah.
All right. Local anesthetic is the best choice for IVRA, for Bier blocks. Which one of these things would you choose for your Bier block?
If you're in the Rolling Stones, it might be a different answer.
Different answer for Keith Richards, but yeah. And over 2/3 got the correct answer, which is prilocaine. Right. So, which you don't use very much here in North America, but across the rest
of lidocaine for it.
Yep.
This was put in this week.
So if not, yep. So did you do one? IVRA? Yeah. Oh, good for you. Yeah, it's again one of those techniques that I think ends up being a lot of MRB. Trainee hasn't done one ever, and they'll say, "Hey, I've read about Bier block. Can we do an IBRA?" Sure. All right. Excellent. Finish the lyric. Block me, mama. Fill in the blank.
This was the Grammy-nominated cover version. Is that, am I correct in remembering?
I'm sure there are contestants right now going, I have no idea what this question means. Yeah. But
this is a real Blocktober deep cut.
Deep cut. You have to have attended previous Blocktobers to really know. 80%. That warms my heart to see this.
I'm eye roll here.
It also makes me happy that at least one person answered, so the pigs don't squeal.
And we have something that was clarified here in the chat. Was that Grammy or Granny nominated? David McLeod.
Who was it? What muscle is indicated by the arrow in this image? And I hope you can see this muscle.
Image.
Yeah, small image.
That looks like cervical. Does that mean neck when you say cervical anatomy?
It does.
Okay, just checking.
Yeah, that is the correct. That's the other cervical area. And so this is, all right, okay, good. I'm glad that the image was clear enough for you to see, for most of you, that this was the longest coli muscle. An important sono landmark for stellate ganglion block. When you're doing ultrasound guided stellate ganglion blocks. Fantastic. All right, let's take a look at our leaderboard. It's been a couple of questions. Okay, still Alan, Chris, and Tado. Still 1, 2, 3. Yeah. Tim came up the board there. Fantastic. All right, still questions left here, guys. We're entering the final 15 minutes, but there's room to move. Refresh those drinks, and let's go. Stuart is teaching awake fiber optic intubation and topicalizes his airway with benzocaine. He begins to turn blue and become confused. Jeff should grab, which one of these answers? His phone and call 911. Not a bad answer. No. His phone and record a video for a future YouTube video.
I would hope not.
Maybe not the best answer. Should I grab Stuart's tongue and open his airway? A vial of methylene blue? Or should I grab a quick cab to the airport? I was never here.
Never saw it.
Best answer, methylene blue. So famously, benzocaine, an ester-derived local anesthetic that can provoke methemoglobinemia. Treatment for that, methylene blue. Yeah.
I was working in neonatal intensive care a lifetime ago, 30 years ago, and a gorgeous little girl born with congenital methemoglobinemia. Looked like a smurf. And we gave her some methylene blue, and she pinked right up because she had an APGAR score. Everything was fine apart from her colour, but it was.
Wait, is colour one of the ones though in APGAR? Okay, all right. Sorry, it's been a while since I've done OB anesthesiology. Yeah, it's amazing, right?
Incredible.
Yeah, we used to use the benzocaine spray a lot. The one that smelled like bananas, a lot for that, but have stopped. There are better local anesthetics for this. Okay. Question number 5. This answer, the arrow in this picture, shows a good example of which type of ultrasound artifact. Now I know ultrasound principles is something you've taught a lot of in the past, and how to look at different artifacts.
It's a dry and a dull topic.
Yeah.
That's why I'm
best suited to it. Yeah. No, it takes a dynamic teacher like you to make it interesting.
Vaguely interesting. Over out of time. What did people think?
Yeah, post-cystic enhancement.
Yeah, or post-acoustic enhancement. Is that posterior acoustic?
Yeah. Very good.
And if we time it over a quiet beer, it would bore everybody to tears, and watched them live and explained actually how it occurs. But we're going to move on to the next question.
Yeah. All right.
Chris,
Not much
Todd,
change there in the top.
Three pioneers at the front there.
Identify the nerve shown in this image. Is it the nerve to vastus medialis? Is it the musculocutaneous nerve? Is it radial, ulnar, or median? That could be copyrighted, actually. I'm not sure if you can sing that.
Yeah, very good trouble.
Don't come after me, Trebek.
No, Trebek.
All right. It is the radial nerve. All right. Most people got that.
Your wife shed. Trebek.
You can see the transducer there just above the elbow, imaging the humerus and the radial nerve just popping out of the background there.
The lateral side of the elbow. Love that.
Yeah. I like this block. I like it a lot. I like it a lot. Identify the structure indicated by the yellow arrow in this image. Sciatic? Is it a branch of the obturator? Nerve to vastus medialis? Is it the sacral plexus? The survey says, ooh, a strong 85%.
Showing for that.
Yeah, the anterior sciatic. I love this block. It's a good one. I find, just like this picture, it just pops out of the background nicely in a lot of
Trauma,
patients.
that's how I use it.
Yeah, can't roll the patient over and do the posterior approach. Love it. All right, what does the R stand for in the acronym RAPTOR? Is it reimagined, retrospective, retroclavicular, right through the suprascapular nerve, or ring up the chest tube service?
Reprehensible, isn't it?
I'm sure if you have other R names that you associate with Raptor, feel free to put them in the chat. I know it's a bit of a polarizing block, as it were. But let's get the live answer. Oh, there we go. I think right through the super. Do we get to know who puts these answers in?
I'm afraid not. I want to finish my beer with you.
I feel like sending that person
answer number 4 there, right through the suprascapular nerve.
Right.
Ridiculous says probably covering another one there. Yes, ridiculous.
Okay, 39. A 15 centimeter midline abdominal incision. Can't do an epidural. What do you do, hotshot? What do you do? What's your technique of choice? There is a right answer here.
Midline's a sneaky word. Let's see what people decided. What they're going to do. No QL7s, thank heavens.
No QL7s. Yeah, rectus sheath block. I love a rectus sheath block.
Love a rectus sheath.
Like, hashtag favorite block.
So simple, so easy, and actually, even the dressing's on, you can still sneak in the lateral aspect of the rectus abdominis muscle. And
I appreciate how you Sean Connery'd that.
Yeah, surely.
Sneak in.
Surely, some mistake, go finger.
Yeah, and the way that it just lifts off that posterior rectus sheath, it's just beautiful. All right, time and time again. Just checking. Okay, all right. Chris, Tato, you've got a chance.
Yeah.
There's a chance to dethrone Alan.
Depends on how big Alan's bladder is. And if you're going to rest
Drink.
the next minute or two.
Drink, Alan, drink. I've got a patient for shoulder replacement with end-stage lung disease. You don't want to knock out that phrenic nerve. The best single choice for post-op pain is, we might have alluded to this earlier. Oh.
Can't take him away.
Is it IV PCA morphine? It is not. It is the posterior approach to suprascapular. Now, there are different approaches, right? I think you're a fan of the anterior approach for certain settings. Maybe not for this.
Well, not for this.
Yeah.
But I like going a little more distal and reducing the phrenic nerve effects when I'm doing an elective shoulder surgery. But if somebody has got bad lungs and obesity, definitely this. And I combine it usually with an infraclavicular rather than just doing the axillary nerve block.
Yeah.
I get the nerve to subscap and axillary nerve if you do an infraclavicular.
I think that if you do a suprascapular nerve block, back here. Allow me to.
That's good.
Yeah, right there.
That's the spot. That's the
Man,
spot.
you've been working hard recently. Okay, right there.
It's
Yeah.
not-
Back here, infraclavicular. You've basically reconstructed an interscaling brachial plexus bar. I think that's a great solution to that problem. I think a suprascap and axillary, not a bad choice too.
Nope.
Second choice. Folks, we're almost at the end here. We have one more question.
Timing's almost impeccable.
Impeccable timing. And I've still got some beer left.
Okay.
But your last chance for some points. In which city will the ASRA Pain Medicine Fall Meeting be held next month? Is it Lost Wages, Orlando, Chicago, San Fran, or is it in fact Durham, North Carolina? One day.
One day.
One day, maybe. Okay. And all right, over half of you got the correct answer.
Yep.
Which is Orlando.
Orlando.
As an acute pain guy, I don't do very much chronic pain at all, but I've been to the chronic pain meeting. It is fantastic. It is a lot.
It's really interesting.
Yeah.
I'm going to see, and if anybody's going, say hello when you get there.
See Mickey as well.
No, but I'm not a Mickey fan. Sorry, Amit. But I do. I'm really looking forward to the meeting. And some really seriously good looking workshops. So looking forward to that. And there's actually quite a bit of acute pain stuff there. It really opens your mind to some other techniques.
A lot of transitional crossover type stuff.
Yep.
All right. Well, listen. Hey, everyone did amazing. I am impressed with everyone's knowledge base. And let's see what happens here. I'm going to finish the game.
Okay, do you want to go on to 3?
And I think if we go back to the...
back to 3.
There we are. There's our winners. So we have got in third place, Toto with a score of 1838. Second place, Chris with 2025. And in first place, somebody named Alan with 2,244 points. 34 out of 43 answered correctly. But a big shout out to everybody who played. This was a lot of fun for me.
Yeah, amazing how quickly the answer goes down. I had the privilege of seeing them before, and I had to think about a few of these.
This is something we could do on a regular basis, as well. So if you'd like to see more of this, put that in the chat. And congratulations, Dr. McFarlane. You will be getting your swag and prize shortly in the mail. This has been a whole lot of fun. Stay tuned for, still have 2 more days of Blocktober to go, tomorrow and Monday. So some special things coming your way.
More music, maybe?
There's a rumor.
There's
a rumor. So stay tuned. Enjoy the rest of your weekend.
Enjoy what's left of it.
And thanks for joining us.
Thanks for competing.
Yeah, really appreciate it.
Everyone's a winner.
Yeah. but in a more precise way, Alan is the winner.
Congratulations.
Congratulations. Take care, guys.
Bye-bye.
Thanks. Bye.